continuing endeavor of the National Commission on Indigenous Peoples to build healthy and productive Indigenous cultural communities all over the Philippines has reached another milestone through its implementation of IP MNCHN Project-Mindanao. Beyond health, the project has looked into the cultural and socio-economic foundation of Indigenous beliefs and practices in developing programs and advocacies.
One realization we have, particularly for the Office of Education, Culture and Health, is that for social services, that of education and health, is that since time immemorial, Indigenous peoples had their own Indigenous systems, whether it's Indigenous learning systems or Indigenous health systems. And it is a clamor that this will be recognized, and this will be the anchorage actually of what we would like to infuse into the mainstream system by way of what we call the indigenization agenda.
The project maintains culture sensitivity in healthcare as a slogan to call for change in the country's health systems, change in perspectives that govern and influence the delivery of health services for the Indigenous peoples and in geographically isolated and disadvantaged areas or GIDAs.
So of this Joint Memorandum Circular 2013-01 of UH and CIP and DILG, which spells out the guidelines for the delivery of basic health services for Indigenous peoples. So this JMC actually is an embodiment of an almost decade long of advocacy and struggle in the level of policy when it comes to the health of Indigenous peoples. It's not just being stuck to what public health can offer us, but in terms also of what traditional health or Indigenous people's health, whatever nomenclature would be assigned to this, that would form part of the so-called recognition of cultural uniqueness and specific circumstances of Indigenous peoples.
The objective to realize culture sensitivity in healthcare is the focus of programs and strategies of IP MNCHN Project-Mindanao planned under Key Results Area 3. A crucial program in this area is the training program on culture-sensitive health services. It is aimed at equipping health service providers in government and private sectors with the knowledge on Indigenous cultures that affect the health-seeking behaviors and practices of the Indigenous people.
Training muna siyang programa sa IP MNCHN alang sa training sa mga healthcare provider aron mahimo silang sensitibo sa kultura sa tribo.
The training program was developed through a strenuous process of module development and training of trainers on culture sensitivity counseling for maternal and newborn health. The initial rounds of trainings in the 5 project sites and adjacent municipalities have so far trained 494 health personnel.
Atong gisgutan, unlike the rich and the privileged, the IPs in the geographically isolated and disadvantaged areas have no option but to cling to their Indigenous health practices in addressing their health needs, unless opportunity for a culture-sensitive health services is delivered to them by the healthcare providers. The IPs have a chance to access some.
Nalipay kayo ko nga napil ko aning training sa culture and sensitivity for health workers. Aron samot ko makatuon, samot na ko ma-share sa staff sa man ka-importante regarding culture sensitivity. Kay ideally unta tanan health workers apil ang mga leaders makaapil ani nga training aron samot na tumatagan og pagtagad ato makaigsunan nga IPs.
Mga pulo naman ko katuig nga nagserbisyo sa Kulambugan. This is the first time nga ang topic about sensitivity sa mga culture. Daghay mga pamaagi nila nga although wala man gyud siya kaning kuan gyud impact pod nga makadaot sa ilahang pag-practices regarding sa health kay mga ang uban harmless naman siya nga mga ilaha raman silang mapagtuto o ritual Pero usually gina-discourage din so wala siya gina-entertain ba. Yung dili kay nimo siya matagag ma-explore at the same time dili na noon kayo sila mubati og kaning pag dili nila mapadayag ang ilahang gusto ba. Kay right there and then imuhan mo din silang kanang kondangon kung sa ang ilahang mga belief, mga pagtuo, mga practices.
Sa mga facilitation nga akong nahimo, nakita gid nako kung unsa ka importante sa ila nga maka undergo ni nga training. Sumala pa nila sa pagsugod, pangutan sila kung pila ka percent sila nga sensitive sa kultura, mayroon sila ng mga 90+%. Apan sa panahon nga mahuman ang training, ay pa nila ma-realize nga, uy, layo pa man dahil kayo ko sa kamatuoran sa pagkasensitibo sa kultura, sa lumad.
Following its positive review, 3 batches of the training were conducted for 86 health workers of NCIP, DOH, and LGU offices of Regions 1 to 8, including CAR. The aim was to replicate in the said regions the efficacy and relevance of the trainings conducted in Mindanao and to develop a training program specific and relatable to Luzon and Visayas conditions.
The Mindanao experience is now being shared for national application to Luzon and Visayas. So the series of activities that we have had lately is more on training of trainers for culture sensitive counseling on maternal and newborn care. We are into the training of trainers because we envision to have more partners. So it's not limited to NCIP employees alone.
The training for the Visayas batch was held in Cebu City last February 8 to 12, 2016. It was composed of NCIP, DOH, and LGU health focal persons from regions 6, 7, and 8.
This batch, there are from the ILG, from DOH, the regional level, and from NCIP. Now, the ones we handle back home during the rollout are really health implementers. It was easier to facilitate. So that's why during this training, when I asked how many of you had experiences in counseling, and only 3 raised their hands. So I thought, ay naku, how am I going to do this? Because this is a different group. So it was really a challenge.
The initiatives of IP MNCHN Project-Mindanao to have the JMC signed and implement training on culture sensitivity were the first that made the participants appreciate the project.
It's really an opportunity for me to be part of this TOT training in culture-sensitive counseling. So it's not just considering IPs alone, but also with other people. I can make strategize my way of counseling with them using what I've learned here.
Happy ako kasi madami akong natutunan sa mga danger signs sa mga pregnancy. Dapat ko i-apply yun at i-advise sa sa community ko kasi pag hindi yon malala, hindi yan pupunta sila ng hospital.
The first batch of Luzon cluster was composed of NCIP, DOH, and LGU health focal persons of regions 1, 2, and CAR. The training was held in Baguio City last February 15 to 19, 2016. The concerns were less complicated.
What I can say is, pwedeng we do not necessarily go into the IPCC na differently like same as this, but if there is a way na mayroong ma-develop na module that we integrate culture sensitivity in the IPCC which has already been taught to our health workers.
The training module developed by the project was seen more applicable in the case of regions 1 and 2.
Mahalaga ang training na ito dahil lahat-lahat ng training is to respect their beliefs and cultures.
Cluster B of Luzon area are from regions 3, 4E, 4B, and 5. The training was held in Quezon City last February 22 to 26, 2016.
Mas medyo in-depth na ang understanding about the IP. So after this, nagkaroon ako ng talagang need for myself na kailang bigyan sila ng extra pa sa aking ginagawa. Not because there are different groups, kaya lang we need more compassion, understanding, kasi nga baka mamaya yung ginagawa naming mga health programs ay hindi nila masyadong naintindihan. That's why medyo sinasabi namin na hindi sila nakakasunod sa standards na dapat namin gawin.
Sa nangyari ngayon sa seminar na to, sabi ko nga, para itong isang paglalakbay, parang ang sarap ng pakiramdam na ngayon, muli kong binalikan yung sarili ko, saan ba ko galing. Ang greatest challenge sa akin ngayon is tingnan ang bawat programa na involve yung Indigenous group sa punto de vista ng traditional view, hindi dun sa Western point of view. Muli kong binalikan yung aking orientasyon bilang isa pong nurse po ako. So sabi ko, di pala nagkulang dun din sa pagtuturo na ang kultura ay hindi mo talaga kailangang basagin. Ang kultura ay yung dapat mong gamitin para malaman mo kung anong sitwasyon at dun din mo mahahalaw kung anong mga dapat gawin.
The light that the trainings have shed to the country's health system is evident and difficult to suppress. It did not only open the people's consciousness on IP health and culture, but have also revealed realities of health inequities that each Filipino and the Philippine government should admit and address with stern actions and solutions.
We believe that health for the indigenous peoples ay malalim na usapin. With due respect to DOH, dun sa universal healthcare na framework, nandun yung indigenous peoples. But how we look at the need and yung way of addressing health issues of the indigenous peoples is not as easy as that. Because we know very well that our communities may ibang worldview po sila. And meron din silang traditional health system sa loob ng kanilang pamayanan. And so this is where we want really to mainstream itong pagtingin na ang indigenous peoples, yeah, they need health intervention, but what the matter is hindi lang yung pagbigay ng health intervention, but more importantly, how we look at them as people with culture and with their own indigenous knowledge, especially when it comes to health.